I'd like to welcome everybody to today's presentation on anticipatory grief and grief in general. I'm your host, Dr. Dawn-Elise Snipes. Today we're going to define loss, anticipatory grief, and their connection to trauma and trauma symptoms. There's a lot of overlap there, and quite honestly, loss can be, often is, traumatic. We'll explore common symptoms of anticipatory grief and strategies to support people through their process. In a couple of weeks, we will also be talking about grief and strategies to move toward acceptance. Today, we're really focusing a lot more on anticipatory grief, understanding what's going on and supporting people while they are in their grief process. It is not our right to take away anyone's grief. People have to be empowered to feel their feelings and to work through the process, as anguishing as it can be. Loss is the elimination or removal of something or someone that was important to the person. I tend to broaden the definition of grief and loss and trauma to any sorts of losses that cause the person to feel unsafe and powerless. It can be the death of a friend, a loved one, or a pet. It can be the loss of health, functioning, or memory, or the loss of rights, abilities, and safety. So let's go through each one of those. Death of a friend, loved one, or pet. Yes. Okay, we can see where that could trigger grief. And anticipatory grief is starting to grieve before the loss has happened. You know it's coming, and you're kind of trying to prepare yourself, and you're already getting sad. So the first one's pretty self-explanatory. Loss of health, functioning, or memory. A lot of people who have congestive heart failure, who have cancer, who have dementia, experience anticipatory grief, as do their loved ones, because they are anticipating. They know what's coming, and they may start grieving before it actually gets there. And then the last one is a little bit more ambiguous, the loss of rights, abilities, or safety. When people feel like their right to, for example, control their body is going to be stripped from them, they may start having anticipatory grief. For people who feel like their right to live their rich and meaningful life as they define it is going to be taken away. If they believe that that has happened and is going to happen at some point in the future, then they may start experiencing some anticipatory grief. And there's a lot of things we're going to look at with regard to these different types of losses. As I mentioned earlier, often losses involve a profound sense of powerlessness and or hopelessness. All of a sudden, this was taken. You didn't have a choice. You couldn't control it. You couldn't fix it. And that can leave people feeling unsafe and powerless. Anticipatory grief is the emotional pain, sadness, and mourning that occurs before an impending loss. Some people say, especially when we're talking about death, some people say the person who's experiencing anticipatory grief may be living in two realities, mourning the decline or expected loss while simultaneously sharing moments and caring for the person while simultaneously feeling powerless. Experiencing the moment while waiting for the bottom to fall out. Sorry, I mistyped waiting, but whatever. We can also have these two realities in our own head. We mourn the decline of our functioning or our expected losses while simultaneously having good days. And then all of a sudden there's bad days. And it can be very confusing. It can be very disempowering. And a lot of these situations are not static. Dementia, for example. There are a lot of good days, a lot of bad days, and sometimes there is no rhyme or reason. It just is. And that in and of itself can feel exhausting and disempowering because you don't know how to have more good days. It's kind of a guessing game. Both grief and anticipatory grief can be traumatic and can re-trigger old trauma wounds. So let's think about a trauma-informed approach. When people have experienced trauma in the past, they felt unsafe and powerless. Some people respond by feeling like they need to control things, by feeling like it's their responsibility to fix things. Or just they respond when they feel powerless. It reminds them of how they felt back then, and it opens that old wound again. Not only are they responding to their powerlessness in the present, but they're also dealing with the aftershocks, if you will, of the prior traumas that left them feeling powerless. So it can be somewhat additive. We don't want to minimize the experiences of people who are going through a grief process, whether it's anticipatory grief or grief itself, and we don't want to minimize how disruptive and traumatic it can be for them. You may think, well, you lost a pet, for example. Just people lose pets, It happens. Unfortunately, they have shorter lives than we do. However, some people react to that the same way they react to losing a human companion. Maybe the pet is the only thing that showed them unconditional positive regard. Maybe the pet was their emotional support animal. Maybe the loss of the pet is tragic and terrible, and the loss of that pet reminds them of prior losses where they had to watch their loved ones succumb to cancer or something else, and it's repeating the process. It's important to recognize the impact. And I know I've said that like 3 different ways right now, but it's worth restating. How can this trigger old trauma wounds? I talked about unsafeness and disempowerment. People may feel unsafe. What will happen to me after the loss? Especially if we're talking about a loss of a person or a loss of abilities. What will happen to me when I can no longer remember how to brush my teeth? What will happen to me when I can no longer get up to toilet myself? What will happen to me when my parent dies? Even if you're an adult, losing a parent is a big stinking deal. So what will happen to me? How will I survive this? Maybe the person is just unsure. They can't even envision life without that person, thing, or ability. How are they going to survive without having it? I met a woman one time, I can't remember the name of the disease, but she had a progressive visual disorder that was going to leave her blind in the next 3 to 5 years. And that's one of those things. If you weren't born blind or haven't been blind for a while, thinking about how am I going to survive not being able to see can be very traumatic and can leave you feeling kind of unsafe because you're going to have to depend on other people, at least in the beginning. Disempowerment. People may think I'm powerless to keep this from happening, to keep this from negatively impacting me or others I care about. We're going through something with one of our dogs right now. And yes, it's tragic. He's 14. He's lived a good life. It's tragic. It's hard to watch him get old. And my sense of empowerment is pretty low right now. I can't slow down what's happening to him. And on some level, I believe, I can't say I know, but I believe that this is going to tear my husband up. He and this dog have been like, joined at the hip for the past 10 years. And so feeling powerless to protect him, even though he's an adult and he can do it on his own, just fine, thank you very much. There's also a part of me that doesn't want him to feel that grief. So I am experiencing anticipatory grief. And as I said at the beginning, it's not my right to take away his pain. So logically, I shouldn't be worried about this. I shouldn't be dwelling on this, but I am. And recognizing that is important. Another aspect of disempowerment is when this loss happens, I won't be able to. I won't be able to tell the person all the things that I meant to tell them. I won't be able to make amends for all the wrongs that I did. I won't be able to, if we're talking about functioning, I won't be able to engage in activities of daily living on my own. And that causes a lot of disempowerment. We can see how this can be traumatic to people. Many of the trauma symptom domains overlap with grief. When we evaluate for people for PTSD, what do we look for? We look for symptoms of intrusion, avoidance, negative cognition and mood, and arousal and reactivity. Let's think about grief. When people are experiencing anticipatory grief or grief itself, unwanted memories, they start thinking about times when they've gone through something similar to this before. They may have nightmares, flashbacks, or strong distress or physical reactions to reminders of the trauma, reminders of what's going on right now. Again, for me, being around Brewster right now sometimes can just be too much. And I may go downstairs and watch TV for a while to get a little bit of a break because it is overwhelming. It can feel oppressive. Avoidance of trauma-related thoughts, feelings, people, places, or situations. I don't want to watch shows that have a theme of cancer in it. I don't want to watch shows that have a theme of death and dying in it. That's just not something that I'm going to watch right now. Negative cognition or mood, being pessimistic, being irritable, being stressed out, or being depressed. Knowing that you are powerless is a stressor. It triggers the stress response. And at a certain point, the body starts saying, okay, we got to back down a little bit. So people may start feeling exhausted and depressed. That is a normal reaction of ongoing stress. And anticipatory grief is ongoing. Sometimes it's 2 weeks, sometimes it's 2 years. Depends on how long between awareness of the situation and the loss actually takes place. And arousal and reactivity, irritability, hypervigilance, exaggerated startle, concentration problems, and sleep disturbances. When we're stressed, we don't sleep as well. We tend to wake up more frequently for whatever reason. When we start having difficulty with sleep, it disrupts our circadian rhythms, which disrupts our hormones, which triggers the stress response, which makes everything worse, to kind of shorten that thing that I'm talking about. But it is important for us to work with people who are experiencing anticipatory grief and help them to the best of their ability to stabilize their circadian rhythms and do as much as they can to get the best quality sleep that they can. If you're taking care of a loved one that has dementia or cancer or something, you may not be able to get 8 solid hours of sleep if you're the only caregiver. And that's a whole different issue. But trying to get good solid sleep during the windows you can get sleep can be important. And talking to them about respite care, having somebody else come in and take night duty 1 or 2 nights a week if possible. When we're talking about older adults, some of the assisted living facilities have respite placements where people can take their loved ones if they're the only caregiver and they're like, I can't do it anymore. I need a break. They can let their caregivee stay at the assisted living facility for 1 to 3 weeks in order for them to kind of catch their breath and get rejuvenated. So there are things to do. Looking for options like that when we're talking about an older adult, the local area agency on aging can be a great resource for helping people identify ways to reduce their, I guess, what we'll call caregiver burden. For someone who is not older, maybe they have cancer or early onset dementia, or who knows. A lot of times the physicians' offices that are diagnosing those sorts of disorders, like oncologists, will have a social worker that can help the person identify resources that they can get. Medicaid, Medicare, some insurances, long-term care insurance sometimes will cover having a caregiver come in, an out-of-home caregiver, come in a few hours a day or a few hours a week just to give the family caregiver a break. There are a couple of anticipatory grief scales out there, and I link to them so you can look at them. They tend to focus more on grief itself, as if the loss has already happened. So use it for education. And we're going to go through a lot of the domains and a few more that they cover, because these are the things that we're going to want to assess for and assist with. Physically, if the person says, I have a hard time relaxing and seem to be more irritable, well, this is stressful. Your stress response is turned on, maybe turned way on, which means your wise mind, your thinking mind, and your relaxation response, they're turned down. It makes sense. Your body is preparing you to fight or flee. Unfortunately, there's nothing to fight or flee right now. It's just, it is. And sometimes having that energy, having that desire to fight or flee, and there's nothing to fight, can leave people feeling frustrated and hopeless and helpless, because it's like, what do I do? Helping people figure out how to use that energy in a way that helps them move toward their rich and meaningful life is going to be important. Helping them understand that relaxing, or helping them explore, I shouldn't say understand because that's my value, helping them explore whether relaxation is okay and how allowing themselves to relax can help them recharge and be better attuned to addressing whatever this upcoming loss is, or interfacing with the person while they're still functioning, while they're still here. We start seeing psychomotor agitation or retardation. When you have all that energy and yet your brain wants to fight or flee, your brain wants to get control of this situation, and there's nothing you can frickin' do. Sometimes you feel agitated. You can't sit still. You want to make it better. You don't know what to do. You're puttering, you're hovering sometimes, which can sometimes backfire. Or you just can't get out of bed. You're so exhausted, you're so stressed out, you're feeling so helpless that it just feels like you're carrying a 50-pound rucksack on your back and you're just exhausted. If the person says, I'm constantly exhausted, well, it makes sense. You're probably not sleeping well because you're stressed. Your brain knows that there's this thing out there that's a potential threat. And so there's a part of your brain that stays engaged. If you're not sleeping well, if you're feeling stressed all the time, just being tense all the time is exhausting. Your muscles are tighter, your heart's going faster. It's exhausting. Validating is huge when working with people who are experiencing grief. It's not pathological. What you're going through is a normal response to an unfortunate situation. Sometimes it's not even an abnormal situation. It's a normal phase of life, if you will. But it doesn't make it any less traumatic. It doesn't make it any less devastating. I wake up a lot and sometimes have nightmares. With these things physically, we do want to assess how much caffeine they're drinking, especially after noon. We want to make sure that they're eating a relatively healthful diet. When people get stressed, when people are grieving, sometimes they will eat differently. I think that's actually on the next slide. But we do want to assess, are there any things we can do? Or is there anything the person can do to improve their sleep, to stabilize their circadian rhythms, to activate that vagus nerve, that downregulation response, just to give themselves a mini break? And okay, I was right. Nutritional changes. The person may say, I'm eating differently than normal. When we're stressed, what do we crave? We crave energy. We crave energy to fight or flee. So that's fat and sugar, which means proteins, antioxidants, a lot of the other stuff that is useful for building up the body and reducing inflammation, not eating it as much. Encouraging people to pay attention. They don't have to cut out their comfort foods if they feel they need them. You know, there's a time to address comfort eating. However, encouraging them to try to make a point of getting at least 2 colorful meals with protein in every day. That can feel daunting to some people. So how can they do it? Can they order in? Can they, if push comes to shove, getting a TV dinner? There are some healthy ones, healthier-ish ones out there, still high in sodium, but better than eating Oreos and potato chips for dinner. Anyway, encouraging people to consider that, because what we eat is broken down to make the hormones and neurotransmitters we need in order to have energy, to feel happiness, to feel anything. When we're not getting that nutrition, our body is not able to make the nutrients it needs. And when people get stressed, it changes their microbiome, their gut, which means their gut is actually producing different hormones and chemicals, which again, throws off the neurotransmitters like serotonin, making it easier for people to feel dysphoric, depressed, anxious, irritable. When the gut microbiome changes, in addition to changing what hormones and neurotransmitters it's making and in what ratio, it also sends a signal via the vagus nerve to the brain that, hey, there's a threat, there's something wrong here, which further activates the stress response. Recognizing GI distress is normal, especially if the anticipatory grief is chronic. I know when my mother was diagnosed with cancer, hers was actually pretty short. It was about 7 months from her diagnosis to her death. But that's still chronic in terms of stress. And chronic stress can cause GI distress. It can cause imbalances in hormones and neurotransmitters. Encouraging people, if they're feeling off, go to the doctor. Get some blood work done to see if anything's completely out of kilter. People who have autoimmune diseases may have an autoimmune flare during a period of anticipatory grief or grief. And we want them to examine how grieving this loss before it happens, how is that working to help them or move them away from what's important in their rich and meaningful life. Said a different way, do you want to be using all your energy to grieve over a loss before it has happened, or do you want to use your energy to nurture this relationship or this thing and make the most of the time you have? And obviously that's not a tactful way to put it in session, but I'm, cutting to the chase for this presentation. Intrapersonally, so self-esteem, the person may say, I feel confused about my role in life or feel like I don't know who I am or will be anymore. If I'm not John's wife, if I'm not Sean's mom, if I'm not able to engage in teaching continuing education because once my dementia progresses, who am I? What am I if the things that I find are most important to my identity, if those aren't there anymore? What happens? Helping people, again, define their rich and meaningful life, and so define their rich and meaningful life, living in the and. I can have a rich and meaningful life and not be so-and-so's spouse. I can have a rich and meaningful life and not teach continuing education anymore. Is it my choice? Is it ideal? No, but it may be something I can't change. It may be it's just a fact. It'll happen. So how can I lose that aspect of what's important in my identity and still have a rich and meaningful life? I blame myself for this situation. If it is personal health issues, people may blame themselves for what's going on, and they may start grieving the losses that they will experience. Maybe they are diagnosed with lung cancer and they've been lifelong smokers. They blame themselves for their situation, and they start grieving it early, which can really negatively impact their quality of life for the time remaining. It also increases stress, increases inflammation, and increases the progression of disease. So exploring in the situation, what parts were in your control and what parts were not in your control. For the parts that were in your control, okay, you made the wrong choice. You made a choice that could have contributed to this. Can't change it. What can you do now? For example, if they were a lifelong smoker, maybe stopping smoking could be something that could help them prolong their life. I feel more incompetent or powerless. I feel like a failure since this happened. Sometimes when we have a loss or an impending loss, we may feel incompetent because we can't make the pain stop. We can't make our loved ones' pain stop. We can't seem to help them correctly. We can't do it perfectly. Well, nobody can. In exploring what exactly is happening or what exactly is going on that you tell yourself you're incompetent. What exactly is going on that is contributing to your feelings of powerlessness? Let's go through each one of those and look at each one to see, is there anything you can do? Is there any knowledge that I can help you identify? Are there any resources I can help you connect with? When my mother was in hospice, the hospice social worker was absolutely invaluable because I felt incompetent to help her manage her pain during those last few days. And there was a lot of guilt and grief, and you know how it happens, that went on with that. Many times when there is an impending loss of some sort, there are resources that people can call on to help them feel as competent and empowered as possible. We can also ask people, what would it look like for you if you felt like you were competent, if you felt like you were empowered, what would be different? And then we can work backwards from there to figure out, is there anything we can do to help them make that happen? Longing, loss, and rumination. The person may say, I'm preoccupied with thoughts about this situation. Yeah, that's what our brain does. When there's a threat, when there's something we can't control, our brain keeps tapping us on the shoulder and going, hey, you haven't fixed this yet. But what do we do about it? Some people will engage in thought stopping. They will say, you know what? I recognize this is a loss. I recognize, or this is a threat right now. I recognize this is painful. And I am going to choose to not think about it right now. I'm going to turn my attention to something else. Giving themselves dwelling time, similar to what we do with people with anxiety. where they have 30 minutes a day where they give themselves permission to dwell, think about, steep themselves in the situation if they choose to. They don't have to. That can sometimes free up some energy, because sometimes people feel guilty if they have a loved one that's suffering, or if they are, if they've got dementia and they know that's coming. They may feel guilty not thinking about it, not dwelling on it, especially when it has to do with other people. Giving themselves permission. I can focus on my life, these 23 hours and 30 minutes a day, and this 30 minutes here, I can let myself focus on the devastation. Not everybody's going to find that works. However, it's a good alternative for someone who says, but I have to think about it. Okay, let's see if we can, instead of having it invade your thoughts all the time, let's see if we can contain it to a certain time period. I very much miss and long for the way things used to be. Yeah. If the loved one is starting to show signs of dementia, if the cancer is starting to show through, if the loss, you're starting to see signs of the loss, it's natural to want things to go back to the way they were, the way you enjoyed them, the way you loved them. That doesn't mean that you can't have things now that are meaningful. Maybe you can't go hiking with your significant other anymore because their Parkinson's has gotten so bad. All right, well, that sucks. However, was it about the hiking, or was it about the quality time? And what else could you do instead to still spend quality time with this person if you can't go hiking anymore? Nothing can ever replace this loss or fill the void created by it. And that is a choice that people go through whenever they experience a loss. Are they willing to let the loss of that person in their life right now, are they willing to let the memories fill that hole? Or are they going to hold a void, hold a space there? And we're going to talk about that a lot more in the class on moving toward acceptance. I sometimes wonder what my life would be like if this had never happened. Well, but it did. And we can coulda, shoulda, woulda until the cows come home, but it did happen. We can't change what is. We can change potentially what will be. Dementia, for example, there are a lot of things people can do to slow the progression of dementia. Heart disease, cancer, there are a lot of things that can be done to slow the progression. And yes, you may wonder what life would have been like if this would have never happened, and 50 years from now, if you still had perfect health and perfect vision and whatever. But that's not what's going to happen. Therefore, how can you use your energy now? Interpersonal disconnection, and this is one of the big risk factors for persistent anticipatory grief and prolonged grief disorder. When people feel completely disconnected and unsupported from others, they're just sitting there with this load and they're bearing it all on their shoulders all by themselves. Some people may say, I felt very much alone since this happened. Okay, tell me about that. Are there people around? Number one, sometimes people just scatter like cockroaches as soon as something bad happens, and the family that's usually all up in your business is nowhere to be found. Okay, so that's one thing. If they're physically absent, all right, where can you find support? Some people feel very much alone because they don't get the sense that anybody understands their point of view or their perspective. Or maybe They're anticipating, for example, when my mom died. My dad died 20 years before. And when my mom died, I was like, I'm not going to have parents anymore. And yeah, I was almost 50 years old when my mom died. So it's not like I really needed a parent around, but I still miss having her around. Sometimes there are days where I want to call her and tell her something. And I can't do that. And that sense of aloneness may be, again, not feeling like other people understand what they're going through, or it could be part of the anticipatory grief where they are already feeling abandoned or alone. I feel a need to talk to others about the situation. Well, that's wonderful, but are you doing it? Sometimes people, which goes down to the next one, I don't feel like others would understand my reactions. Sometimes people bite their tongue because they don't feel like there's anybody they can talk to that would understand. When, we'll go back to Brewster, my mother-in-law, sweetest woman in the world. She's just a godsend. She's a lovely woman, but she was raised differently than me. And to her, animals are animals. They're not part of the family. They're not, whatever. She would try to understand kind of where I'm coming from, but her ability to really empathize might not be there because she's never felt that way about an animal. I feel like others blame me. And this would be something looking at how, for example, how you're taking care of a loved one. Others blame me because this bad thing happened. Others blame me for not taking care of somebody well enough after the bad thing happened. Others blame me for. Many of these things I have felt, okay, but those are feelings. Tell me what is objectively going on that is contributing to those feelings, and let's take a look at it. Let's see what, if anything, can be done. I feel like others blame me is one of those things that may involve mind reading. I'm assuming others blame me for this. I've worked with parents who have lost a child to SIDS, and a lot of times they assume other people blame them for what happened. Now, that's not so much anticipatory grief, but it's certainly something that people feel. I avoid some people since this happened. Well, sometimes that can be healthy. Not everybody is going to be supportive. Not everybody is going to be able to be there for you. They may be all up in their own stuff. If the person says, I'm avoiding everyone since this happened, that's keeping them isolated from social support. Let's talk about who are the people you're avoiding and why. To explore if it's, healthy avoidance. I need some space. I don't have the energy to deal with your drama. Or if it is, I'm avoiding you because I'm afraid you're going to criticize me. And I find it more difficult to get along with certain people. Again, when we're stressed out, this makes sense. We already are on sort of a short fuse. So if there's somebody in your life who knows how to push those buttons, you may have more difficulty getting along with them. You may have more difficulty with patience and tact. That's normal. When your wise mind is offline and you're kind of stuck in fight or flight, tact and patience kind of go out the window too. Now, we don't want to use that to excuse verbally abusive behavior or something, but helping people recognize it makes sense. It makes sense. And once this is passed and you've had a chance to reorient, you may be able to get along with them better. What can you do? How can you set boundaries? Is there something you can communicate to them that is that would help you interact with them right now. Sometimes it's just letting them know, hey, I am going through a whole load of crap right now, and I'm on edge. Therefore, please give me a wide berth, give me some space. Sometimes that's all it takes. Sometimes it may be, I'm having difficulty getting through the day right now, putting one foot in front of the other. And I just don't have the energy to debate with you on things. Okay. Communicating, assertively putting out there, what is it that you need from this person? And then if they decide that, hey, I can't or won't do that, well, that's on them. Emotional distress. The person says, I seem to be more irritable since this happened. And we've talked about irritability in multiple different ways. When we're stressed, think of a bucket. And you can only fill the bucket up so much. When you're grieving, when you're going through anticipatory grief, when you're a caregiver, when you're not sleeping well, when you're not getting proper nutrition, all those are stressors. And that's filling up that bucket. How much of that bucket is already full before you even get out of bed in the morning? So if you've only got this much before the bucket starts overflowing, it makes sense why your patience fuse is, nil. What can you do, if anything, to drain that bucket some? What are some strategies? What are some things that have helped you feel like you could breathe? I have periods or bursts of tearfulness or hopelessness. I have periods or bursts of anger, resentment, or bitterness. And I have periods or bursts of impending dread as I think about the situation. All of these dysphoric emotions are completely normal. Helping people recognize the thoughts that are contributing to those emotional reactions and evaluate those thoughts, restructure them as they feel is appropriate, can be helpful, but also validating that grief bursts are normal. In anticipatory grief and in regular grief, you can be having a great day, things can be going fine, then all of a sudden something can trigger you and you have a moment. That is okay. You may not like it, the person may not like it, but it is a perfectly expected reaction. Sometimes those feelings, you're suppressing them, and then they just break through for a minute. All right, so what do you do? Mindful awareness and acceptance, distress tolerance can all be really helpful here. Sitting with that feeling. And I've shared with y'all before, when my mom was very ill, she saw a bird fly by out of her window, and it was a hawk. And I said, "Ooh, that was a beautiful hawk." And she repeated that to me multiple times. And she said, hawk. That's a new word I learned today. Well, no, we'd been bird watching for decades. But where she was, she didn't remember that. And whenever I would be driving down the road and I would see a hawk sitting on a power line or flying overhead, that memory would come back and I'd have a little moment. And over time, over years, it got to the point where sometimes that memory didn't even get triggered, but helping people recognize that that's normal. It's unpleasant, but it's normal to have those moments, those breakthrough moments. The key is, what do you do with it? When I would have those moments, I would feel sad, but then I would turn my attention to the bittersweet memories of bird watching with her. I'm like, she brought ornithology into our lives. And again, I have zero frustration tolerance. Your stress bucket, it's full. Frustration tolerance, you're trying to get the jar off the pickles and it just won't come off. And yeah, that's something that is, quote, stupid to get frustrated about, but that frustration is just sitting right here and it's got to have somewhere to go. Something as simple as not being able to get the lid off the pickles makes your stress bucket overflow. Okay, recognizing it, acknowledging it, down-regulating can be really helpful. Avoidance and denial. People will say, I often avoid reminders that the loss is coming. Sometimes that may mean avoiding the person. If you're getting ready to lose someone or something, for your own functioning. Sometimes avoiding reminders like trying to going to physical therapy. People may start skipping those appointments because they don't even want to think about the fact that the disease is progressing. I can't enjoy things I used to because they all have reminders of what I'm going to lose or what other people have. Going to the park and seeing families. Maybe I used to love doing that and I don't do that anymore because I'm envious of people who still have their parents, or whatever it is. But recognizing how is the person's behavior changing? How is what they do changing? How are the things that they once enjoyed being avoided or ignored now? And for what purpose? Is it, if it's because it reminds them of what they're about to lose? Okay. Well, for that person, they may decide that for right now, I'm not doing that. I just can't manage it. For example, if you have a loved one with cancer and you were volunteering in the oncology wing, maybe you choose not to volunteer there right now because you've got enough to deal with thinking about your loved one who has cancer. That's okay. But encouraging people to objectively evaluate, is this something that I want to cut out of my life? And I'm unable to accept the fact that this happened. And a lot of us sit in that place of denial for a long time. We want to believe it's a misdiagnosis. We want to believe there's a cure out there. We want to believe that it's not going to happen. And encouraging people at a certain point to recognize what is and what they have the power to do henceforth. If you're diagnosed with dementia, for example, recognizing it is. It sucks. I have to accept the fact that I might have dementia, and I can use my energy to grieve about it, to be angry about it, to stew on it, or, which all will speed up the progress of the dementia, or I can accept that it happened and use my energy to do everything I can to enjoy the time I have left and slow the progression. Cognitive changes. Well, when we're in fight or flight, our prefrontal cortex, our executive functioning, it's offline. Concentration, memory, they're not going to be there. Encourage people to write things down. There's no sense using energy you don't have to use, trying to remember something you're probably not going to remember. No, just write it down. People will often search frantically for ways to change the situation, doing research, asking people, going to multiple doctors, trying to find an alternate truth, and exploring with them whether that is an effective use of their energy to move toward their rich and meaningful life. And I feel more pessimistic about everything. Our brain, unfortunately, is wired. When we're feeling stressed, we notice the threats and we almost discount the good things. And helping people understand that their brain is actually causing them to feel more pessimistic, encouraging them to consider focusing 20 minutes a day. The other 23 hours and 40 minutes, they can do whatever they want. Focus 20 minutes a day on what was good about today, what went right today, what was beneficial today. And especially when you've got somebody, for example, who has dementia or cancer or something that has a variable course, recognizing and celebrating those moments of empowerment, those moments of hope, can help buffer. It doesn't negate the trauma of the loss or the impending loss, but it can help buffer and recognize that, oh my gosh, I love this and I'm glad I'm not missing this time with you before you go, whether it's cognitively or physically. Traumatic re-experiencing is very common in grief, as I mentioned at the beginning. This situation, whatever this impending loss is, could remind them of past losses. Multiple family members I've had have died of cancer, so I've been through the hospice thing multiple times. So each time it happens, yes, it's a new situation, but it also reminds me of the prior situations, which again can be additive. It can remind people of times in the past when they've been powerless or unsafe, even if it wasn't a loss per se, but that sense of being helpless to change a situation can reignite traumas from the past. And times in the past when my worldview or sense of self has been shattered. If you always thought that you were going to be an astronaut, I don't know, and then you suddenly realize that, that wasn't going to happen, your sense of self as an astronaut, this was your dream, this is what you worked for all your life, or somebody who planned to be an Olympic athlete and they blow their knee out during the Olympic trials or something. That's a huge loss. That's traumatic. And whatever this loss is, could remind them of a time in their life when something happened that completely changed the trajectory of their life. And acknowledging that. Yes, this is going on. Is there also something else from the past that this is reminding you of? Managing anticipatory grief. There's a lot of stuff. One of the biggest things is validation. People feel how they feel. Not everybody cries. Not everybody gets angry. Not everybody goes numb. Some people feel an extremely intense reaction towards something that somebody else may not have as an intensive reaction. You feel how you feel, and validating that. For a lot of people, tying it back to the physiology and helping them recognize this is a neurochemical-based response to a threat. Can give a little meaning to it. It's not, you can think yourself out of this. You can't will yourself out of this. This is a real threat, and it's a real physiological response. Validating that for some people can help them potentially embrace what's going on instead of telling themselves they should feel differently or they shouldn't do this. Help them define what a rich and meaningful life in the end is. I want to have my richest, most meaningful life and accept that my parent currently has cancer. So how can I have a rich and meaningful life while this is also going on? Mindfully working toward their rich and meaningful life, regularly choosing, not daily, moment by moment, choosing their actions and reactions and evaluating them and saying, is this helping me move toward what's important right now? Or is this moving me away? Enhancing parasympathetic activation, taking mini breaks to downregulate, accepting the moment, slowing their breathing, seeking safety. Those can all be helpful, but we want to downregulate, reduce that cortisol, give the brain a break so it's not constantly being bathed in all these stress chemicals. 5 minutes, 10 minutes, if you're really lucky, 10 minutes. Once or twice a day actually has been shown to be very helpful at reducing the energetic overload. Helping them recognize what they do and do not have control over. This has happened. You can't control that, but you can control what aspects of it. Your loved one was diagnosed with a terminal illness. Okay, that sucks. You have no control over that. What can you do? What do you have control over? The amount of time you spend with them, how you react to it, etc. Reducing external burden, including circadian disruption. When our circadian rhythms are disrupted, it disrupts our blood sugar, it disrupts our hormones, our neurotransmitters. It makes everything seem harder, heavier, more overwhelming. To the best of their ability, what can they do to stabilize their circadian rhythms and get, we may be dreaming here, but get a good solid 7 hours of sleep? And if they can't do that, what is the closest they can get? Improve social support and reduce isolation. This may mean connecting them with support groups, connecting them with their spiritual leaders, connecting them with maybe one other person who's been through something similar. Sometimes people are willing to be sort of mentors or guides through the process. If they've already been there, they can sit with you while you go through it. Sometimes it's connecting them with social workers or programs that are able to help them reduce their isolation and get more support. Enhance resilience, focusing on dialectics. As I mentioned, helping them accept and acknowledge what sucks. We're not taking that away. And we're also going to acknowledge that there are some good things going on. And that can be really important. Maybe it's not necessarily the good things with the person. Maybe mom has cancer or something, but Junior just got straight A's or made the honor roll, and you've got a job and you've got a roof over your head. This over here sucks. Yes, not denying that. But there's balance. There is something in there to kind of balance it out. So everything in life is not oppressive. And encourage people to recognize the impact of prior traumas. Recognize how those prior traumas, those prior periods in their life where they felt hopeless and helpless, are intensifying their desire now to not feel powerless and unsafe. How are those things working together? And what can you do, talking to the person, what can you do that would help you feel safer, more competent, and more empowered in this situation? Are there any questions? Jen, I'm sorry to hear about your mom. Alzheimer's is a beast. And it is, as they say, the long goodbye. And that anticipatory grief is extensive. Yeah. I like that, Becky, that we can hold hard and beautiful at the same time. We can enjoy parts of life while also still suffering in other parts. And enjoying parts of life or celebrating the good in life doesn't negate the suffering. It just balances it in some ways. Alrighty, everybody, have a wonderful, wonderful rest of your day. And for those of you who have any questions, feel free to message me at support@allceus.com. Otherwise, I will see you next week, same bat time, same bat station.